Okay, we are on part 3 of our cranial bone lecture. I am trying to keep these videos about 15 minutes so that you guys can watch them into smaller increments. And I think it's easier to digest that way. So let's jump in, and we're going to go to the frontal bone. So again, if you don't have your book, pause, go grab it. Your book is going to be really important as we're going through this so that you can follow along, and obviously pause anytime you need to take a reference for that. So your frontal bone starts on page 87 in your human bone manual. Okay, so our frontal bone, and is that bone right here, is our forehead. Okay, let me just do this. Maybe it's a little bit easier if I just have this guy here. I don't know. We'll figure it out. Okay, so our frontal bone is right here to our forehead. So let's go over some landmarks on our frontal bone. Okay. So as you guys will see, there's a pattern for each bone. The first thing that they do is what they call the anatomy, and that's just some like definitions and things like that. If it's not on your sheet, you're not responsible for it. And as we found in the last lecture, if I skip a landmark, you're not responsible for it. Some of these, without being in the classroom, are going to be a little bit harder to get. So I'm going to skip a few of them. I haven't edited this sheet because I'm assuming at some point we'll go back to being in class. So if I'm not doing it, you guys are not responsible for it. I am editing a little bit as we go. Okay, so frontal bone. Your frontal eminence. Okay. So, your frontal eminence. That's just this part right here. Okay? This is your frontal eminence. You're going to see, so it's hard to see, but you have like a little bit of a ridge right here. Okay, so some of you guys might be a little bit more pronounced than others. The picture on page 88 does an okay job because there's some nice shadowing that can show you, but there's a little bit of a ridge right here. Okay, so if you were to run your fingers this way, and if we were sitting in class, I would ask you to do the same thing. But now you're in the privacy of your own home. You would feel where it kind of just ever so slightly from here to here dips in a little bit. That's your frontal eminence. So, as with everything with men, that does tend to be a bit more robust. Some folks have really prominent frontal eminences, others do not. But that is your frontal eminence. Okay, your superciliary arch. So, super means above. Ciliary. So, in science, I'm touching them as I'm doing this, so if you guys are wondering what I'm doing. Your superciliary arch, so cilia. If anybody remembers in biology, cilia are like little hairs. So, cilia, hair. Superciliary arch. Your eyebrow arch. So again, anatomists are naming things for exactly what they are. They're just using their fancy Latin words. Super, above, cilia, eyebrow, arch. So it's above the hair arch. So it's your eyebrow arch, right? So, on this guy, or I suspect this is a lady, this is her superciliary arch. So it's not the actual eye socket, okay? So don't get confused with this ridge right here. It's this bump, okay, that you would imagine you would be drawing eyebrows on, okay? The superciliary arch, okay? And you can see it in your picture. Okay, they've kind of got this skull in the picture angled down like this. So it makes it seem in the picture as if they might be pointing to this ridge. It is not. It is this, okay? The eyebrows. Superciliary arch, okay? Now, is that going to be more robust in men or women? Men. Always bigger and more robust in men. Men tend to have big brow ridges, okay? So, Big brow ridges is another clue that your skeleton or your skull might be a male. So this one, we've looked at a couple landmarks so far. Remember, we're going to go back to this one here. Your external occipital protuberance, those temporal lines, these brow arches, this frontal eminence are all pretty slight on this skull. So I'm guessing, as of right now, that I think this is a female skull that I have here, that I'm using for you guys. Okay, the supraorbital notch. Okay, so in my skull, mine actually look like little foramen. Okay, do you see that hole? So this is something that's really important to remember when we're looking at skeletons. These individual variants can be tremendous, okay? Variance from individual to individual in these landmarks can be pretty big. So in this particular skull, those supraorbital notches are actually more foramen. See those foramen? Okay, but if you look in your book, you can sort of see the notch. It would just be that the bottom part of this is open. And that's how it would typically be. But when we're talking about forensics, when we're talking about bones and osteology, all that stuff, typical has a very wide range, okay? So your supraorbital notch on this guy or this lady is actually a foramen, but it would be right there. And again, when we talk about naming supraorbital, so here's your orbit. Supra means above, right? It's above the orbit. Let me get this finger in here. This here would be, if we're going to imagine it's a notch, so it's a notch above the orbit. Supraorbital notch. Okay, metopic suture. You are not going to see a metopic suture on an adult skull. So what I'm going to do is I'm just going to take a pause here and flip back to a previous photo. We've seen this guy somewhere. Oh, we did. I was talking about it. Where is it? Okay. So let's flip back to page 84. Okay, so let's go ahead and look at that newborn skull on page 84. So here's our picture you guys should be looking at. And do you see in this picture that there's a suture that runs right down the center of this frontal bone? So when you're a newborn, when you're an infant, you actually have your frontal bone is separated by a suture, and it's called the metopic suture. So when you become an adult, you don't really see that suture in the same way that you see other ones because it fuses so early in development. Your other sutures fuse much later as you grow, so that metopic suture isn't typically obvious in a adult skull. So you can even see by the time you're 3 years old, you can't see that suture at all anymore. So if you're seeing a metopic suture, obviously the size of the skull is going to be very small, but that's going to be an indicator of the age. Okay, that is a newborn. They have that metopic suture that divides that frontal bone. Okay, right down the middle. So you're not going to see that in your adult skull, but if you're looking at page 84, you do see that in the newborn skull. Let's go back. All right, so I'm going to just scoot back. Okay, so you also have a temporal line on your frontal bone, which would make sense, right? Because this muscle here, this temporal muscle attaches here. It also attaches a little bit in the front, right here. So on page 89, you can see there's a line pointing right here, okay? Your temporal line. So imagine that temporal muscle, big flat muscle, okay? It sits right here. And that's really important, right? Because that's a muscle of mastication. It's a muscle for chewing. Moves your jaw down. And it's very, very strong. All right, our ethmoid notch. Hold on. Okay, while I take the top of her head off, it's a little stuck. Okay. So our ethmoid notch. Okay, what I did a quick overview of where all the bones were. I did point to this triangular bone as the ethmoid bone. Okay, so in the frontal bone, it connects to the frontal bone a little bit. There's a notch. Okay, so this triangle is the ethmoid bone. Where it sort of connects here with our frontal bone, ethmoid notch. That would make sense because it fits right in to the ethmoid notch. Frontal crest. Do you have a picture? There's a great picture of that ethmoid notch here. So just imagine that ethmoid bone is sitting right in there. Okay, so we also have the frontal crest. Okay, that's going to be in the picture here. Okay, so that's going to be, if we're looking at the inside, you guys can see it, there's a crest right here. So it would be internal, like right, you go right here on the inside. Okay, so it goes from the ethmoid notch up. There's a crest, and a crest is a raised line. Okay, and there's a beautiful picture of that on page 90. And then we have our frontal sinus. Is it showing you a good picture of the frontal sinus? Okay, so the frontal sinus is just that. It's this area here where your sinuses would sit. I'm not seeing it pointed out. But this is your frontal sinus, okay? So you can imagine when you've got a sinus headache, that kind of happens right here. Still getting used to the camera, right here. There we go. On either side, there we go. Here on either side, that's where your frontal sinus sits. Okay. So those are all of your frontal bone landmarks. So we have our frontal eminence, right, which is this here. We have our supraciliar arch, which is where our eyebrows are. There's an arch there. We have our supraorbital notch, right? So that's, remember I said that she's a little weird, but that's her notch here, right above the eye orbit. The metopic suture, we're only going to see, just moving down here, in infants, okay? So it divides that frontal bone right there. Temporal lines on the sides of the temple, right? So we talked about how that temporal muscle attaches there. Ethmoid notch, the notch where your ethmoid bone is going to sit. That crest, frontal crest, is going to be on the inside. Your sinuses are going to be on either side above your eyes. Beautiful. All right. So, frontal bone down. Let's check that off. Just putting her top back on because we are going to go to the temporal bones. Okay, so let's see. Temporal bones are on page 95. Go ahead and take a moment to move over to page 95. All right. So, squamosal suture. Do you remember we talked about that, right? So this is your squamosal suture, right? Suture. So this rounded, sort of circular area is called the squamous. Squamous, squamosal suture. So this flat area here, if we were in person, you'd actually have this disarticulated, so you can get to see what this looks like. But this is sort of a flattened area here, okay? This is the squamous. This whole area is considered the squamous. your zygomatic process. Okay, do this for me. Touch your cheekbones. Okay? Your cheekbones, when we get to the face, are called your zygomatic bones. Okay? So, there is a process. So, a process is something that sticks out on your temporal bone. It's called the zygomatic process. That's this area. So you can see it sticks out. It's a process. It's like a little finger sticking out from your temporal bone that attaches to your cheekbone or zygomatic bone. This is your zygomatic process. Okay? So a process is something that, unlike a bump or a tubercle, it's more of like that. That's the best way I can describe it. So this process sticks out. Okay? This is your zygomatic process. And then this little triangle here is your zygomatic bone. But we'll get there when we talk about the facial bone. Okay? Your zygomatic process. Yes, you know, it's very odd they don't have that labeled in your book. Ah, they label, okay, on page 99, there's a photo, so you just have to turn over one more. There's the photo, or the labeling of the zygomatic process. Okay, supramastoid crest. You know, let's find the mastoid process first, because that's going to make supramastoid crest much easier to find. So, your mastoid process. Let's go ahead. Behind our ears, you're going to feel a big bump. Go ahead and do it. No need to be embarrassed because you're in the privacy of your own home. Okay, so there's a bump back here. Okay, you can poke on it, you can feel it. Okay, that is your mastoid process. So it's another area in which the muscles of the jaw attach. This is your these are all your muscles of mastication. So mastication means to chew. Okay? So if you guys, I know in Niagara County, there's a lot of farms. If you guys have ever been around cows, sometimes they refer to that constant chewing as mastication, right? The cows are always masticating. They're always in the field chewing. They are using their muscles of mastication. We have a mastoid process, okay, that one of our muscles of mastication attaches to. So this is right here. See, that's the whole figure. I'll try the technical term we'll get to. And this is your mastoid process, okay? Mastoid process is big. See how big that is? It's big and bumpy, right? It's your mastoid process. Gender identification. In males, it's going to be bigger. So it's another one of the landmarks that we can use to determine gender in a skull. Okay? Men tend to have bigger, more robust muscles. They tend to have bigger, more robust jaws, which means they're going to have bigger, more robust mastoid process. Okay. So I did skip a term because I feel like it's a little bit easier to find it after we find this one, because that term is supramastoid crest. Supra means above. So if we find it's the crest above the mastoid. So here's the mastoid. There we go. Oop, there's a crest. See it? There's a little crest right here. So supramastoid, above the mastoid crest. Supramastoid crest. Okay? So hopefully, at this point, some of these terms are starting to click. So if you're able to know where the mastoid process is, that's one of like the keystone landmarks. So there's a few keystone landmarks. The mastoid is one of them. If you know where that is, and I say find the supramastoid crest, you should be able to think, okay, mastoid, supra, above, crest. This crest above the mastoid. Okay, so meatus. Meatus is a canal. It's another term for a canal. So our ear canal. But in this case, we're not going to be easy. We're not going to call it our ear canal. We're going to call it our meatus, which is a canal. Okay, so we have an external and an internal acoustic meatus. So acoustic, what does that mean? Sound, right? So it's our ear canal. It's the hole on the inside, it's the hole on the outside. So our external acoustic meatus, our external hearing hole or hearing canal. External hearing canal, external acoustic meatus. Okay? So we have an external. We also have an internal. Let me see. That's the best way to do. Here we go. There it is. Okay. So if you were holding the bone, it would be a lot easier to find this for sure, because I kind of just put my finger in his ear hole on the outside, and then I'm kind of able to follow that to the inside. So it's right, there it is, right there, okay? And you can see all of this is your internal ear canal. It's just obviously covered in bone. So that's where the sound comes out. You have a nice picture of it, okay? There's a really good picture of it in your book. Your middle meningeal groove. That is going to be tough for me to show you on the skull. I just don't think the lighting when I go internal is very good. So, in your picture, okay, you can see it right here. It's pointing to it. It's really, I'm still getting used to, the camera does the opposite of what I do. It's like mirrored. There we go. You see that groove? That is your middle meningeal groove. Again, that's going to be where either a nerve or blood supply is going to sit in there. Articular eminence. Okay. You have a picture. Let me just debate it. Yes. I'm going to skip that one. You guys don't need that. It's going to be hard for you. We don't have it in your book. Mandibular fossa. Okay, this one definitely we need to do. Okay. So your jaw connects right here to your temporal bone. Okay. A fossa is a groove. Okay. This bone's called your mandible. I can pop it out. Okay. So where the mandible sits in that groove, that's the fossa. Okay. Your mandibular fossa. Right there. Okay. That's where your mandible sits. Mandibular fossa. The next two, your carotid canal and your jugular fossa, I'm not gonna do. Again, without physically being able to hold these bones, these are a little bit tougher. So those are two terms that you guys can cross off your list. And we probably will cross off a whole lot of the sphenoid, just because without being able to see it separate from the skull, it's a challenging bone. So let me see if I can find the sphenoid in your book. Okay, and this makes me sad because I'll be honest, the sphenoid is my favorite bone. So your sphenoid, we're actually going to skip ahead in the book to page 117. So you can see at the top, they always do these great photos that orient it. So this is your sphenoid bone. Okay, so in our skull, It sits right here above the eyes. So if you look at this picture, nope, this way, okay, this picture right here, it looks like a butterfly, okay? So your sphenoid has a body, okay? The body is going to be the area in the middle, which would be the body of the butterfly, if that makes sense, okay? So if you're imagining this as a butterfly, the body of the sphenoid is the body of the butterfly. We also have a greater wing and a lesser wing. The greater wing is the one on top, the bigger wing, and the lesser wing is the one on the bottom. So if you think of a butterfly, right? A butterfly has its wings. Its top wings are a little bit bigger. Its bottom wings are a little bit smaller. Exactly the same for the sphenoid. Imagine it like a butterfly. So you've got the body of the butterfly is the body of the sphenoid, and that big top wing, superior wing, is the greater wing. That smaller wing is the lesser wing. Okay, sphenoid. Whew, goodness, we're not going to be able to do a lot of these. That makes me really sad. Let me look in your book really quick and just see if there's anything else that makes sense. Okay, I am going to talk about the pterygoid plates, just because I think that those will be easy for you guys to remember, especially if we can't see these. Okay, so if we look at the legs, okay, see how there's two legs? These are your pterygoid plates. They actually label them here on this side, but I think this picture is a little bit dark. So you have pterygoid plates, okay? So if we're thinking about the pterygoid plates as the legs of the butterfly, we have two legs. The medial pterygoid plate is going to be the leg that's closer to the midline, okay, the center. And then we have a lateral pterygoid plate. So we have two legs sticking down. Two legs on either side. Let's do it this way. These are your medial pterygoid plates if we're looking at the legs, and these are your lateral. So the medial are closer to the midline, the lateral are on the outside. Okay. I think for our purposes, that's all I'm going to give you guys. Let me just see. Yeah, that's all I'm going to give you guys. So imagine, please imagine this sphenoid bone as a butterfly. The body of the sphenoid, greater wing, lesser wing, and then we've got those legs sticking down. We've got our medial pterygoid plates and our lateral pterygoid plates. So if you're looking at your term sheet, pterygoid is spelled PT, like pterodactyl. The P is silence. So that's all we're going to do for the sphenoid. Where are we on time? Okay, this one's running a little bit long, but let's go ahead and just talk about the ethmoid bone really, really quick. So there's not a lot that you guys need to know on the ethmoid bone. Okay, ethmoid. Okay, that is page 112. I'm going to give you guys two landmarks. Okay. Okay. So if we look down at the bottom, we can see we have. Actually, I'm going to give you. Yeah, I'm going to give you two landmarks. I'm going to give you the cribriform plate. Okay. So if you're looking at this, you see this area that looks like Swiss cheese on either side. That is your cribriform plate. Okay. And then this fin, and if we were to look at this bone here, this is what we would see. So you see this little sharp fin. Okay. That is your crista galli. Crista galli. Okay. So yeah, I'm just going to give you those two. Crista galli. So the crista galli is like this little shark fin almost that sticks up. Okay. And then your cribriform plates are these sort of more Swiss cheesy areas on either side. Two landmarks on the ethmoid bone. Okay, so we finished. What did we do? What the heck did we do? We did our temporal bone. So we talked about our acoustic meatuses, we talked about our squamous, our zygomatic process, our mastoid process. We talked about our sphenoid, the butterfly. We talked about our ethmoid. Okay, so that is it for the cranium. So you guys are done with your cranial bones. And next week, I can't remember what our order is. But anyways, after this, you guys can start jumping into the module with the facial bones. All right. Have a great day.